Age-related macular degeneration is a degenerative disease of the retina and represents the most common cause of blindness in individuals older than 65 years in developed countries. It is classified into two major forms, dry AMD and wet AMD. Dry AMD is caused by deposition of various metabolites under the retinal pigment epithelium, drusen, and usually develops over decades. While wet AMD is caused by neovascularizations growing into the subretinal space and manifests within weeks to months or even acutely. Both forms ultimately cause impaired central vision and can, in rare cases, lead to complete blindness. Age macular degeneration is a multifactorial disorder. The risk factors include advanced age, family history and genetic predisposition, cardiovascular disease, smoking, and obesity. A 75-year-old woman visits an ophthalmologist because she has noticed a gradual decline in both her distance and near vision during the past 2 years. In particular, she has difficulty reading, focusing on objects in front of her, and adjusting her vision to the dark. She denies pain in her eye or any associated trauma. Fundoscopic examination reveals deposits in the macula and abnormal vision as assessed by the Amsler grid, see in the figure. Her peripheral vision and extraocular movements are intact. What is the abnormality in this patient's vision as assessed by the Amsler grid? The Amsler grid assesses the degree of central vision loss. In this assessment, the patient covers one eye and, with the open eye, focuses on the dot at the center of the grid. Patients with vision deficits in their macula will exhibit metamorphopsia, meaning the patient will see a distortion of the grid. What is the macula? The macula, located temporal to the optic disc, is the area of the retina that is specialized for central and fine detail vision. The center of the macula is the fovea, which has the highest density of cone photoreceptor cells in the retina and the smallest amount of convergence to bipolar cells. This provides for exquisite detail in visual perception. What is the most likely diagnosis? Age-related macular degeneration, in which central vision is blurred, is a significant cause of vision loss in the elderly. By contrast, glaucoma typically affects peripheral vision while sparing central vision. Central vision loss can also be caused by optic neuritis and cataracts. What are the two variants of age-related macular degeneration? There are dry and wet forms of macular degeneration. Dry AMD, non-exudative or atrophic AMD. Accounting for approximately 85% of cases, dry AMD progresses slowly and typically represents an earlier disease stage. It is characterized by the deposition of drusen, yellow-white spots consisting of lipids and proteins like vitronectin within the retina. As the disease advances, progressive atrophy of the retinal pigment epithelium, occurring centrally or paracentrally, leading to gradual vision loss. Wet AMD, exudative or neovascular AMD. Affects about 15% of AMD patients. Wet AMD is less common but causes significant blindness. It results from choroidal neovascularization, where abnormal, fragile blood vessels grow from the choroid into the subretinal space. These vessels leak serous fluid and blood, causing sudden localized elevation of the macula, detachment of the retinal pigment epithelium, hemorrhage, and scarring. What's the treatment for age-related macular degeneration? AMD treatments vary depending on the type and stage of the disease. For wet AMD, antivascular endothelial growth factor injections and photodynamic therapy are primary treatment options, aiming to stabilize or improve vision. Antivascular endothelial growth factor injections. These medications block the production of vascular endothelial growth factor, a protein that promotes the growth of abnormal blood vessels in wet AMD. They are injected directly into the eye to reduce the formation and leakage of these vessels, stabilizing or improving vision. Photodynamic therapy uses a light-sensitive drug and a laser to target and destroy abnormal blood vessels in the retina. It is sometimes used in conjunction with anti-VEGF injections to further control wet AMD. There are currently no effective treatments for dry AMD, but vision aids and lifestyle changes can help manage vision loss. Studies suggest that dietary supplements containing vitamins C and E, lutein, zeaxanthin, zinc, and copper may help slow the progression of advanced dry AMD. Emerging therapies. Complement cascade inhibitors. Drugs target the complement system, which plays a role in AMD, and have been shown to slow the progression of geographic atrophy, a severe form of dry AMD. Light therapy, photobiomodulation. Some studies suggest that light therapy may stimulate eye cells and prevent oxidative stress, potentially slowing down AMD progression.